Hello everyone, I am Prateek Kumar Tiwari, Assistant Professor, IIMT College of Pharmacy. In this video, I am going to discuss the topic which is diabetes. As we know, diabetes is one of the most common disease which we heard in our day-to-day life. So, and according to report, if we're talking about diabetes is widely happening disease, and if we're talking about in US, every second person in the US is whose age is more than 40 is facing the same problem, means he have a diabetes. Now we discuss what is diabetes. Diabetes, its full name is diabetes mellitus, is a group of disease basically which is characterized by high level of blood glucose resulting from defect in either in insulin production or there's a deflection in the action of the insulin. So it means if there is an imbalance of insulin, it causes it. Then you have a diabetes, right? So now we discuss how prevail the diabetes mellitus is. If we're talking about approximately 537 million of adults, it means age between 20 to 79 years, are living with diabetes, and 537 million is a very high number. The total number of people living with diabetes is maybe rise up to 640. It is projected that 643 million people have diabetes in upcoming 4 to 5 next years. And now what is the scenario? If you're talking about in low or middle income class countries, out of 4, there are 3 adults which have those who have a diabetes, and almost out of 2, there's a 1 adult living with diabetes and are undiagnosed. This is a very critical scenario actually. If the person have a diabetes and is not aware of that, so this causes the several more pathological conditions like a blur vision. Sometimes patient loses their eyesight, the failure of livers and kidneys. So there's so many complexions associated with that. Diabetes causes 6.7 million deaths till date, right? So the prevalence is so high. It is not so if you have anyone have a diabetes, so we have to take a medicine, we have to take a preventive measures to maintain the blood glucose level. So more than 1.25 million children and adolescents are living with type 1 diabetes. Basically, if it is we're talking about type 1 diabetes, it is causes due to genetic factors. So type 1 diabetes is basically a genetic one, right? And out of 6, if we're talking about neonatals, it means very childs. Out of 6, there's a 1 live birth which are affected by diabetes during pregnancy only, right? So this is all about the prevalence of diabetes mellitus. Now, what is the symptoms of diabetes mellitus we discuss here? First, actually, it causes 2 things. If it is in a very initial stage and we take a precautionary measures, it does not affect the function of our basically we can say our organs or like that, but in the long term it damages our different body organs like basic organs like kidney, liver, which I already told in this previously. So it damages the kidney, liver. Sometimes it causes the blood. Sometimes it causes the higher in the blood pressure and all these complications are there. It also affects the cardiac output and all the things. Often symptoms are not severe, may be absent in the initial stage of diabetes mellitus. We won't feel we won't see the symptoms. Maybe we don't feel the patient who have a initial stage in the initial stage of diabetes mellitus. Maybe you don't have a any symptoms like that, but consequently if the it is hyperglycemic event is repeated and it is like that only, it means the glucose level is higher continuously, so it causes the functional changes and develop the pathological conditions. If it is not diagnosed for a very long time, it causes the severe, more complex sessions regarding the causes various diseases and all the things. So there's a now we discuss the short term effect. So the patient whoever in an initial stage of diabetes, what he observed frequent urination, excessive thirst, unexplained weight loss, extreme tiredness, irritability, blur vision, and slow healing of cuts and wounds. So there is a 3-4 things which is I want to add over here. If you have a frequent urination in the throughout the 24 hours, you get your urination frequency is increases day by day. So you have to take care of yourself, because maybe it have a symptom. It is a symptom of diabetes. Maybe your the blood glucose level shoots high. So it is there. You have get excessive thrust. There's a lot of setting over there. And you feel tired basically when if you maybe you walk for 500 meter or 700 meter, you feel tired, like you have a blurred vision, you get irritated, you are not. And second thing, if you get any injury, maybe sometimes it sees that we see that if the patient have a diabetes mellitus and suppose that he have some muscular bite or something like that, and he just rubbed there and there's a little bit of wound is created there, so it's that wound injury, small injury converted to wound, and so it's so lethal sometimes. So the patient who have a diabetes, if you have a wound, if you have a cut, you have a 2 to 3 symptoms. If you have a frequent urination, excessive thirst, you tired very easily, and if you facing if you have a blurred vision, and most important, if you have a wounds and cuts and it won't be very frequent, it's a very much uh, you can say you maybe you have a diabetes, right? So long term effect, what it does, it causes cerebrovascular disease, means disease related to cerebellum. Retinopathy it causes. Initial stage you feel blood, but if you won't take a medicine, you won't take care of a blood glucose level, you fall into retinopathy, or and you have a maybe you have a blindness, permanent kidney damage. So you can see the patient of renal failure, you can observe that there most of the case the patient have a diabetes mellitus as well. So permanent kidney damage causes heart attack, because I already told it's affect the cardiac output. Right now there's a diabetic foot infection. It means the person have a, what is diabetic foot infection? Basically, what happens in the diabetic foot infection? The foot get there's a little bit blue color or black color patches you can see on the foot of the diabetic patient. It is a hard, there's a swelling, there's a pain, right? Peripheral numbness in the toes or in the peripheral neurons. So it is like that. So this is the long term effect. Short term effect, in initial stage you can feel, and if you won't take care of your blood glucose level, and you won't take a preventive measures, you maybe face these problems like cardiovascular disease, retinopathy, blindness, permanent kidney damage, and heart attack. Now, what is the main symptom? Main symptoms of diabetes, right? Which one is more common is in type 1, that is lethargy and stupor. Smell, you have a smell of acetone, you can feel maybe. Weight loss is there, weight loss is there. There is a hyperventilation, it means you can take your respiration rate will be increases. In the gastric, you can if you're talking about, you can feel nausea and vomiting, abdominal pain and cramps are there. In urinary systems are defect, you can face polyuria and glycouria. Eye blood vision, I already told. There's an initial stage, it is a blood vision, and after the, after some time, it is become a, we can say, it is a, patient get blind if it not take care of the blood glucose level, right? Now we discuss in the next slide. We discuss the rest of the thing, like causes. There's several things. First one is genetic. Actually, genetics is the one of the prominent cause of diabetes mellitus. Infections in our liver or pancreas or several infections also causes diabetes. Food and lifestyle means late night, uh, disturbing the sleep cycle, late night dinner, and all these things causes the diabetes. Obesity is the one of the reason. Abnormal function of pancreas, which I already told here. So it is all these things. It is all the cause which is the causes of diabetes mellitus. Now we have to understand the homeostasis maintained by body, how it's caused. If we see here, beta cell of beta cell, which is present in the pancreas, which is responsible which secrete insulin, and we know insulin is the hormone which function is maintaining in the maintenance of blood glucose level. Pancreas, what pancreas does? From pancreas, there's insulin release from the beta cell, and insulin goes into our blood cells. They maintain the blood glucose level. If it is a high, suppose the blood glucose level get high, what happens? Insulin get released. Insulin goes there in the muscles and cells, use the glucose energy and convert into glucagon, and that glucagon, after conversion, blood glucose level get lower. Just after, when the blood glucose level get lower, pancreas get feedback through feedback mechanism. Pancreas get signal and inhibit the secretion of insulin. After few time, again, just when the blood glucose level get increase, what happens? This again, pancreas beta cell secretes insulin, and this function goes on. This function go in a cycle way. From means, when your blood glucose level get high, beta cell releases insulin. Insulin goes in the cells and converted glucose into glucagon. After that, what happens? Blood glucose level falls, and blood glucose level falls. So your blood glucose level get, when the blood glucose level get fall into normal range, what happens? There's a inhibition of the release of insulin, and again, just when next time when the blood glucose level, same process starts over there. There's a type of diabetes. Basically, it is of two type. It means there is no insulin. It means in type 1 diabetes and type 2 diabetes. Okay, you're right. So what happens? Type 1 diabetes basically, and third one is gestational diabetes, right? So now I only talk here. We talk about first about type 1 diabetes. Means there is no insulin. It means the beta cell won't secrete the insulin, right? And in type 2 diabetes, if we're talking about, there is less insulin, plus there is a insulin resistance, right? It means insulin get produced by beta cell, but it is not sufficient for the body. Means it is not the amount of insulin which is secreted is not that much sufficient to maintain the blood glucose level. Now we're talking about gestational diabetes. Gestational diabetes is basically a diabetes which is occurs after the pregnancy, during the pregnancy maybe, right? Women's majorly sometimes we see their blood glucose level get a high, or they may have a gestational diabetes during pregnancies, right? Type 1 diabetes, it means insulin-dependent diabetes mellitus or juvenile onset diabetes. Develops when the body immune system destroyed pancreas beta cell, and the only cell in the body that made hormone insulin that regulate blood glucose level. It means type 1 diabetes. In the type 1 diabetes, what happens? There's a immune system. What it does? It destroyed the beta cells, and that beta cell, which is beta cell, as we know, is responsible for the secretion of insulin, which insulin is a hormone which regulates the blood glucose level. Actually, type 1 diabetes basically we see into the child or a young adult, okay? And it may account for the 5 to 10% of the all diagnosed cases of diabetes mellitus, right? Risk factor, what is that? First thing, type 1 diabetes majorly happens due to genetics, right? And 88% cases is genetic based and 12% cases is related to other risk factor, maybe due to some disease condition, etc. Or and 1% and environmental factor and viral infection may also lead to a type 1 diabetes. So genetics plays a very important role here. It means type 1 diabetes majorly happens due to genetic factor, but in some cases it is due to the other risk factor like infections, there's a viral disease, maybe something like that, right? So this is the pathophysiology of diabetes mellitus. See, healthy pancreas cell, this is a basically a, we can say, glucose molecule, this is a insulin. So a healthy pancreas release this insulin, this this goes into muscle and cell, convert glucose into glucagon and the blood maintain in the blood glucose level. But in the case of type 1 diabetes, what happens? This pancreas have, we can say, there's a no insulin secretion in from this pancreas beta cell. So what happens? There's a more glucose in the blood, and which is what is type 1 diabetes, right? So it is like the same mechanism is here. So now we discuss type 2 diabetes. What is type 2 diabetes? Also known as non-insulin dependent diabetes mellitus or adult onset diabetes. Type 2 diabetes basically we see into the adults, and it is account for 90 to 95% of all diagnosed cases of diabetes mellitus. Basically, type 2 diabetes is the widely happening type of diabetes mellitus which happens in adults, right? What is the modifiable risk factor for type 2 diabetes? Non-modifiable risk factor, we can say history of gestational diabetes. If you have a, so it is non-modifiable. You have a maybe genetic effect. We can I already discussed diabetes primarily happens due to genetic factor as well. And type 2 diabetes majorly you can see happens after the age of 45. And it's also depend on, again, it's also depend on if you have a family history is diabetic, we won't change it. So it is modifiable risk factor. What is modifiable risk factor? We can do physical inactivity is there, you can go for physical activity, so it is modified. If you have a high body fat, you have to decrease you lose your weight. If you have to decrease your fat, right? If you have high blood pressure, you have to take care of it, and you have to maintain the blood pressure by medications. All these things, it is a basically this is a modifiable factors, and this is, we can't change this now. We can't change our genetics, we can't change our gestational diabetes history, we can't change our age, right? So it is like that. But this we can do. What we can change? We can change like physical activity, we can do inactive, we have to go for active, and like that only. So pathophysiology, I already say what happens in that. Beta cell produce the insulin, but the amount is not sufficient to regulate the blood glucose level. So in this case, we take the medicine, we take the sometimes we have to take the insulin injections directly, right? But in case of type 1 diabetes, there's no medicine which helps. We have to in case of type 1 diabetes, patient have to take only insulin shots, right? So it is like that. And this is the pathophysiology which I already discussed in this video. So it is like, now we discuss, now we move forward. So this is how the insulin resistance happened. Means there's a, there's a insulin is there, but receptor won't get accepted. Means for the activity, molecule have to bind with the respective receptors. So if there is any deformity in the receptors, the insulin get bind over there, but it will produce their action. Gestational diabetes, I already told, it is happens to women during pregnancy. So It is more occur frequently among Africans, Americans, and American Indians. So it is also common among obese women. We means those women who have obesity, and those who have a family history of diabetes. So they have a they may have a more chance to get gestational diabetes. After pregnancy, 5 to 10%, it means women will get gestational diabetes, and which lead to find to have which is again this gestational diabetes found to have a type 2 diabetes. Women who have a gestational diabetes have a 20 to 50% of chance to get diabetes in upcoming in next 5 to 10 years, right? So what is the diagnosis? First one diagnosis is there. We can do A1C test, fast glucose sugar test, and glucose tolerance test. So A1C test we give if you do if your blood glucose level is 6.5% or above, your diabetes. If you have it is in between 5.7 to 6.4 means you have a pre-diabetic, and if it is a below 5.7 you have a normal. In fasting glucose level, you do if you have a 126 mg per deciliter, it means you have a diabetes. After that, if you have 100 to 125 mg per deciliter, you are in a pre-diabetic condition, and in a normal condition it is 99 mg per deciliter or below. If we're talking about glucose tolerance test, is 200 mg per deciliter or above, 140 or 199 mg per deciliter. In case if there's a range is 140 to 199, it is a pre-diabetic condition, and your range if your range falls between below 140 mg per deciliter, you're in a normal condition, right? So it is a random. What is random glucose blood sugar test? Means after taking the meal, randomly your blood sample will collect and use for getting your blood for checking the blood sugar level. Fasting blood sugar test, what is it? It is basically what we do, what does into that. Before taking the meal, your blood sample has been taken, and it is observed and tested for the presence of blood molecules in that sample. So it is like that. Now we discuss 2-hour postprandial blood glucose level. A 2-hour postprandial glucose level test measure the blood sugar actually 2 hours after the start of a meal, right? It means just after taking the meal, from a very next 2 hour, after very next 2 hours, we take a blood sample and check the level of blood in level of glucose in the blood. Medicine, there are so many medicines, but I only mentioned few. That is metformin, insulin injection, which I already told. Glamparide is there, acarbose is there, which is widely used nowadays. Means it is a very new generation of medicine which is used in the prevention of diabetes. So diabetes prevention, first is you have to get more physical activity, get plenty of fibers, go for whole grains, lose extra weight, skip fat diets, and just make healthier choices. Means you have to maintain your sleep cycle, you have to take a good food, you have to go for exercise and all this. That's all from my side. There's a few myths and facts is there. Better food, you can don't take, exercise cure diabetes. Basically exercise prevent diabetes, not cure diabetes. Paddy foods is the best cereal, but it won't is not bad for diabetic patient. Control of blood glucose, control of diabetes. No, diabetes is if you get a diabetic, you have a diabetes. If you control the blood glucose level, it doesn't mean you prevent yourself from diabetes, right? Thank you so much. That's all all from my side.